are going to talk about microneedling versus Botox. And I have to say, if you want immediate results, Botox is your answer. If you want long results, microneedling could be your answer. Let's talk more about it. My name is Dr. Lynn Neiman. I am a board-certified anesthesiologist, and I am the owner and operator at Blossom Medical in Northern Virginia. I'm also fellowship trained by the American Academy of Anti-Aging, and I love practicing aesthetic medicine. I'm glad that you've tuned in today to talk about microneedling versus Botox. And I have to tell you, this was a little bit of a perplexing question for me, that some people were interested in finding out which we should choose for just overall, I think, surface of the skin looking its best. And I thought about it a little bit more and kind of sifted through this question and was thinking about what could we be talking about in terms of just overall skin health, wellness, and the way that the surface of the skin appears. And I thought about what microneedling might be this question. Now, there are home microneedling devices. There was a microneedling device that I believe a skincare company had talked about in the past. It's kind of like a roller that you roll on your skin. There are stampers. There are lots of things that you can buy on Amazon to microneedle at home. By the way, I don't recommend any of those for sterility reasons, for reintroducing bacteria to the skin, doing little micro tears that can cause some problems with the skin. So I don't recommend doing any microneedling or using those devices at home. But we do have some microneedling devices here that I'm going to just bring to your attention. One is this little amazing guy that we're going to talk about later. This is a little micro channeling device that we can put some amazing product into that affects the surface of the skin. And then we've got our Skin Stylus, which is a microneedling device that can do some beautiful treatments to the surface of the skin. And then our radio frequency microneedling. Microneedling in general, this guy's a little bit of an exception, but microneedling in general, so like skin pen, Skin Stylus, that kind of microneedling, or radio frequency microneedling. You may have heard of Morpheus. We have something called a Genius radio frequency microneedling device here. Those devices are collagen induction devices. And so by their treatment, what they are doing is they are causing a really controlled injury to a portion of the skin. And so it's asking the skin in a really organized way to go into a healing process and improve the amount of type 1 and type 3 collagen that we have in our skin, and then also the organization of that type 1 and type 3 collagen. And that is going to improve the quality of the skin over time. And it will improve things like surface line and wrinkles. It'll improve things like acne scarring. It will improve things like just overall texture and tone to the skin. Those are things that microneedling can do, but microneedling takes a certain amount of time to heal, and then it takes time to induce the collagen response. And typically that's going to take 8 to 12-ish weeks from our radiofrequency microneedling, and it's going to take a similar amount of time from our Skin Stylus microneedling. So you may see an immediate kind of glow to the skin, but really to get that collagen induction, it's going to take some time. So with any microneedling procedure, you are going to have amazing results that are going to really help boost the overall health and quality of your skin, but those results are going to take some time. And those results will continue for some time, because once we've asked that collagen to upregulate, we're going to see those results last over time. Like anything else with our skin's always changing. It's a living organ, so it's always going to respond to our own health, our environment, sun exposure, any illness, anything like that. Our skin is responsive. How much water we're drinking in a day, how much caffeine, all of those things play a role. So if you're loving the results that you're getting with microneedling, it should be something that you'll need some ongoing maintenance to do. But with our Botox treatment, that is more of a different kind of time frame for you to see a result. So typically with Botox, with Dysport, with Daxxify, with Jeuveau, you are going to see that responsiveness just kind of kick in a couple of days. About 3 to 5 days, you're going to start to feel a response, a difference in your expression lines, a difference in just your resting lines on your face. And that will reach its peak at about 2 weeks. So about 2 weeks, you're gonna have that beautiful treatment that's kicked in that allows you to feel awake, refreshed, just beautifully renewed, and make your friends look at you and say, it looks like you got a great night's sleep, or did you just come back from vacation? That timeline is now a couple of weeks, right? A couple of days to like 2 weeks, and that treatment is gonna be kicked in. That treatment is gonna last for about 3 to 4 months, and if you're loving the results of it, you need it to be repeated. So if you're looking for a refresh and renewed just appearance to that overall surface of the skin, that Botox treatment or Dysport or Daxxify or Jeuveau, those treatments are going to give you that result in a more expedient, so a quicker fashion. With our microneedling, those results, the change to the surface of our skin, are going to go through that collagen induction therapy or that collagen induction, and that's going to take some time. And so our results are going to be achieved over time. Now, here's the beauty of those treatments is that you don't have to pick one or the other. If there is something that you're trying to treat, if you're trying to treat acne scarring, if you're trying to just treat overall improvement in skin, surface lines, wrinkles, overall skin texture, overall just beauty and health of the skin, you can microneedle and Botox just at alternating times. And that works out because if you think about it, our Botox is acting at the muscle layer of our skin. That's really, really deep in our skin. That's where that activity of that medication is. And it's reducing the continuous stress and strain that that muscle attachments are having on the back of the skin. And that's why we see its effectiveness. Collagen induction therapy is happening at the dermal layer of our skin. So if the muscle is down here, the dermal layer of our skin is up higher than that. It's a completely different part of the skin. And by inducing that collagen reaction, we are overwhelmingly going to help improve the quality of the skin. If we do both of those together, so the Botox is some prevention of just pull on the repetitive pulling on the back of the skin, and we're asking the skin to produce more collagen. That's using two completely different tools in our toolbox, and those things are going to interact really well and play really well together to give us beautiful wow results that will, going forward, really work together to give us lovely skin. And so do you have to choose one in order to get beautiful skin? The answer is no. You can use both of those together to get lovely results. One of them, the microneedling, is going to take a longer time for you to see those results. Botox is going to be more quickly in action, but it's also going to last for a limited amount of time. So you can use both of those tools in your toolbox. I often find in the world of aesthetic medicine, when we try to treat every nail, everything like it's a nail with a hammer, I think that's how the expression goes, I think that's where we go awry. So when we're always trying to use one tool in our toolbox to fix or to find the solution for everything, I think that's when things kind of get off track and we can, see those weird results where things don't look normal. But sometimes when we pull different tools from our toolbox and use them judiciously, and we use them because we have a clinical endpoint that we're trying to achieve, this is the important part. We have a clinical endpoint. Let's say maybe that's some acne scarring or some surface lines and wrinkles, and we're using our Botox for prevention so those wrinkles don't get deeper, but we're using our microneedling to do some resurfacing. That's a beautiful way to not overuse either one of those and get you a really lovely result. So sometimes more than one tool in the toolbox, using that together is going to get you a beautiful result. So in this case, I think you could probably do both depending on the clinical outcome that you want. This is why, as a doctor, I'm a doctor, but I'm not your doctor. It's important to have a conversation in person with someone. You should always have a diagnosis and a clinical endpoint that you're working towards so that you know that you're using the correct tool in order to get you the result that you want. I've got one other little thing that I wanted to tell you about, and that's this little guy right here, which is sort of the best of both worlds. Now, this has, I'm gonna put this up close to the camera. This is a little chamber that we can put some amazing products in. We use a brightening serum that's got some glutathione and some other antioxidants and some retinol. And we can also put a little bit of Botox in this bad boy right here. And a combination of those things with our little microneedles. So now we're getting that little bit of collagen induction. These needles are small, so they don't do some of the same job that our skin stylists and our radiofrequency microneedling do, but we are microneedling the top part of the skin. It's also creating a little drug delivery, so we can deliver what's in here down to the deeper layers of the skin. And that Botox that we've put in this microchamber can actually act at the very, very surface of the skin. It makes the skin look poreless and it makes the skin look beautiful. We call it our airbrush facial here because it really creates a lovely, lovely canvas to the skin. So this is kind of a short-acting combination or marriage of the two of those treatments that we talked about. And it's something that you can look for in a provider near you, or if you are in the Northern Virginia area, we'd be happy to talk more about our airbrush facial in person with you. Also our skin stylist and Botox treatments or radiofrequency microneedling. If that's something you're interested in, you can always look at the links below. That will let you know how to reach out to us in order to schedule an appointment. If you are nowhere near Northern Virginia but still have questions or trust us to be a part of your skincare health and skincare journey, we do offer virtual skincare consultations where we can create a beautiful customized skincare plan for you to really just take out all of the question marks that you have about skincare and really help hone in on the products that are going to really get you the results that you want. And we can deliver those in a beautiful box right to your door so that you can start using those skincare products, and we can walk you through that journey and be a part of that step-by-step process of getting you the most beautiful and transformative skin that you are looking for. You can find the link to do a skincare consultation below. I am so just honored that you took the time to have this conversation with me today, and I hope I answered some questions about maybe microneedling versus Botox, but also sometimes why it's better to do a little bit of each of those things in concert with each other and use multiple tools in order to get you the results that you want. If you have any other questions or comments, I'd love it if you would just drop those in the comments below. And if you're looking for extra information, remember you can always click on that ... and that will take you to those extra links and connections that we have for you there. So if you found this content at all helpful, I would love it and really be appreciative if you would like and subscribe. And if you know any of your friends who you think might really appreciate this content or find that it answers questions that they may have, I would love it if you would share that information with them. And as always, if you have other content ideas or if you have questions really truly that you just are looking for answers for, I would be really grateful if you would just drop those in the comments below, and I will try to do my best to answer those for you. Again, I'm Dr. Lynn Neiman, and I am so excited that you joined into this conversation. I hope you learned something, and I hope that it helps you make beautiful choices. Thanks so much.